that you can use. But sometimes when you use a hand towel, it sounds a bit strange, but rather than, because it's, if you've got a tumble dryer and you don't mind paying the electric, then if you tumble dry it, it's nice and soft and fluffy afterwards. Not so good for manipulation. You'd almost want the towel that has a little bit of oil residue, but you've washed, but it still not feels clean. You know what I mean? And you're thinking, oh, I'm just going to put that in a bin. Don't put it in a bin, okay? Just keep it. I remember I had an old towel in my clinic, and it felt almost if you squeezed it, oil would come out. Yeah, it'd been washed, but it still had that texture of oil. Oh my God, that was my manipulative towel, that was. But one of my staff, Claudia, would say to me, John, can you please get rid of that towel? Eventually I did, but it took a couple of years. Yeah, for me to get rid of it. And it's brown as well, do you know what I mean? Like a horrible brown looking colour. Yeah.
Originally white.
yeah. So using a towel, so the idea of a towel, if you roll it, and the key is actually how you roll it as well, and it needs to feel firm. Okay, if it feels too soft, when you do the technique, it's going to absorb all your effort, so nothing really happens. So these are the stages that we're going to. The height of the couch is 1. Yeah, climbing the ladder of 10. Yeah, the position of the patient. Yeah, back to you. The position of a towel on you. So for a man, it's easy because I tend to put it around my sternum. For women, for obvious reasons, okay, you might have to adapt it depending. You might have to come up and under. You might have to come this way. Some people will go over that way. But still for some, yeah, it still might be awkward depending. So I will show you another technique later. Now, when I'm doing this one, let's say for instance, we've assessed and we've decided that T6, T7 is fixated closed. Does not matter if it's on the left or on the right, because when we do this technique, it's not a position of manipulation, it's a manipulation to gap both sides. So we're not directing it to left or right. Yeah. So tomorrow is more positional manipulation, like when we do this area in here. So that'll be the area that we're going to apply the towel. Okay, so let me come on to it. So about T6, 7 area. And then I would drop down. I'm not ready, I'm just going to go through a process. So I would drop down and my sternum would drop to that level, you see? So rather than being too high or too low, so the couch is about right. If it is too low, some of them are electric, yeah, or hydraulic, you can pump them up or press a button. So try to find one. If you're shorter, you obviously need to adapt the height of the couch, all right? And if you're taller, you need to adapt it. So that's where we're going to drop down to. Now from here, I suggest I bring the right arm under the left arm. I'm watching, okay? I tend to pull the shoulders and I increase the tension in here. Now this hand, there's a lot to think about. This hand, think about, be careful where hands are here. So one hand on this elbow, and I would normally flex my patient down until I feel tension to the level in my chest. Try not to over flex it. Remember the chest to draw, you pull until you feel a bind. Okay, you don't pull until it starts to move, just until you feel the tension point. So it's increasing the tension of the ligaments. Now this hand on this elbow, and then from here I'm going to then slowly pull my patient to me whilst I'm pushing my chest to her. So if I think about it logically, I'm pushing T7 anteriorly, relax, anteriorly as I pull her arms to bring T6 posteriorly. So you can almost say it's like an AP technique, anterior, posterior. They call it like an AP, yeah? What you call it, PA if that's going backwards, but you can work out the maths. One is going forward as one comes back, yeah? I call it the thoracic thrust. Now, when we do the technique, so this is the stages. Now, once I decide to do it, I'm either doing it or I'm not doing it. I'm either manipulating or I'm mobilizing. Okay, that's the choice. Yeah, so you're either going to be mob or you're going to be manip. And if you're going to manip, it's a thrust. If you don't thrust, it's a mob, and if you do thrust, it's a manip. Obviously, there are two fields now, if you like. One massive field of the mobilizers, and we're all mobilizers, but over in the corner, which is where we are now, we are trying to go into another field, but it's got a gate, okay? That gate we're trying to open, and we want to be allowed. Some of you might already be in there, so I'm naturally in there waiting for you to join me. So some of you will go, I'm not sure if I want to go in there. So you put your toe in and you go, I don't like this because it feels quite hot and dangerous and I want to bring my foot back out. And you would just stay in the immobilizing field. And now and again you might venture in, okay? But most of you will not and venture back out, yeah? You'll understand what I mean very quickly, okay? Within the next 10 minutes you'll know whether you want to be in there or not, yeah? because you'll find this is quite difficult to do. The 1 to 9 I show you and guide you and help you, but I can't do the 9 to 10 for you. Yeah, as in the manipulation, as in the HVT. So when I do it, I will do it quite fast. So the chest to draw. So when I pull, I'll be pulling fast enough to break the seal. Hopefully there's a cavitation. If there's no cavitation on technique 1, I will do technique 2, which means I use a little bit more pressure. It's hard to say how much because I don't know. So I'll just use a bit more effort. No cavitation on 2, that's me done. Okay? So if there's no click, I don't do a 3rd and a 4th and a 5th. If it doesn't cavitate on the 1 or the 2, I will probably just show on someone else. Yeah. Because you don't know if it's, I'm not assessed it, you don't really know if it's going to. It probably will for most of the technique I show you. Okay, but it doesn't mean it will for most of you, yeah, when you are doing it. So maybe ask the patient, are you okay for me to do it? Yeah. Now, the word yes might not be enough in a court of law. So if you wanted to, in your notes, you might adapt your notes to consent. Yeah, and then sign here, sign your life away. Yeah, okay, you know, then you might have to say if there are potential some risks, yeah, you know, life, you know, chance of death. All right, but you might not want to write that one for the thoracic spine, you know, the lumbar. In the neck, you might have to if you are learning the neck, okay, because the chance of a stroke is, though it's 0.000%, there's still a 0.0% chance. All right, so but the same chance on your haircut, okay, when you go on your hair wash in that position, okay, you can get a stroke that way as well. So if you want them to sign something, yeah, and then if there is an issue in time, and they said, oh, you know, are you hurt? And you said. And then also, once you've done it, ask them how they feel, okay? And if they say they feel okay, yeah, maybe you just write down patient felt better after the technique. And if there's an issue in a week or 2 or a month, and you go, well, you said it was okay, the technique, and then you said it felt better. So I don't understand what you're trying to achieve from you know, yeah. And you go, oh, okay, I didn't realize I did that. And then you probably won't hear from them again. All right, so it's just trying to cover yourself. But make sure if you are going to manipulate and you are asking a patient to give you money for a manipulation, make sure you've got the insurance, yeah, to cover you. And it's not cheap. BGI will charge you